All right. Hello, everyone. Here we go. I believe last time we left off right before we talked about the two main diseases categories. So the first one is known as structural disease. Typically, this involves a physical or biochemical change within the cells. this this can come from two different sources. This can come from exogenous factors, which means it comes from outside of the body. The changes in the cellular biochem can actually occur due to outside forces. Examples of these are through trauma, exposure to chemical injury, microbial infections. So when we talk about exogenous factors, there are many different facets to this. And like I said, trauma can initiate biochem changes. Your body reacts to whatever trauma it's encountering. If your body is going through some sort of trauma, your body's going to try to adjust to withstand and overcome that trauma. Sometimes it's able to, sometimes it's not. Now, when it's not, that's when long-term damage and death ensues. When it does, recovery can happen. Microbial infections. We're going to talk a lot about that within this course because that is pretty much the hallmark for this course. When we talk about viral infections, bacterial infections, any pathogen that can come in and cause infection, okay? Now, our second category is endogenous factors. Those are internal. Those have to do like with autoimmune reactions. People who suffer from autoimmune disease, their body reacts differently to exposure to an outside pathogen. We also have hypothyroidism. Hyper and hypothyroidism can contribute to many different biochem changes within the body. Thyroidism, your thyroid also dictates weight. So if you gain a lot of weight, it could be because you have a thyroid issue, especially if it's unexplained. If you have a nutritious diet, if you're active, you're walking, you're doing stuff like this, but yet you're still gaining a lot of weight, this can attribute to your thyroid. So the doctors will look at your thyroid, see if your thyroid is operating correctly, and if not, then there's medications and stuff they can put you on. A hallmark characteristic of structural disease is known as a lesion. So whenever we get a infection or exposed to one of these pathogens, it could lead to a lesion. Now, anytime we're talking about a cellular change within the body, this is a structural disease. That cellular change can come due to a cut, a fracture, because when you fracture a bone, what happens is your body starts sending all sorts of different cells and lymphocytes to that area to try and start the healing process. And when the doctor splits your bones, stuff like that, it will start a calcification around that fracture site. So that's what heals that fracture. Typically, once that fracture heals, there's so much extra calcium built up, it becomes very difficult to re-break that. And I'm not going to say that's impossible, but it does become very difficult to refracture that at that same site. When we talk about also structural diseases, we talk about masses. So anytime we have like a mass, a mass due to a tumor or something like this, this is due to a biochem disease or a biochem change within the body itself. The one down here on the bottom, this is herpes. This is herpes simplex virus. Now, everyone's familiar with cold sores. Many of us have cold sores. That is a form of herpes. However, that is not sexually transmitted herpes. Okay, this is a form of a herpes simplex virus, but there's different forms of HSV. And when we talk about genital herpes, and when we talk about STDs, we'll talk about this. But that is the gift that keeps on giving. That is a friend that never leaves you. So we need to be aware of that. The picture over here to the left, this looks like a ringworm. So once again, this is a pathogen invades the system, and it causes this ring-shaped manifestation on the extremities typically, or it could be on the trunk, could be on the back. Okay. Functional diseases. Typically, these are ones that begin without the presence of any lesion. Basically, when we're talking about functional disease, we are talking about the abnormal function of a cell or a body organ, something like this. So some of the examples are IBS, irritable bowel syndrome. Now, when we talk about IBS, we're talking about there being a disruption in the normal digestive state. Okay, so this is a dysfunction in the normal disease digestive process. Tension headaches. This is due typically because you're holding on to a lot of tension, a lot of stress, a lot of anxiety. And it will manifest itself in through you developing a tension headache. It could be soreness in the neck, maybe some popping in the neck when you go to rotate your neck or tilt it. And these are all types of functional diseases, things that play a role in the function of a body system or an organ. Okay. The manifestation of disease. This is basically when the disease presents itself or shows itself. Different diseases present in different ways. For example, influenza. The way influenza manifests itself is typically a rapid onset fever, high fever, not a low-grade fever typically. Typically, when a patient gets diagnosed with influenza, or starts manifesting signs and symptoms of influenza, this is due to them spiking a very high fever in a very quick amount of time. Also, body aches. Typically, body aches are hallmarks symptoms of influenza. When we talk about tuberculosis, TB, typically with TB, when it manifests itself, it's going to be through night sweats. So you're sweating a lot throughout the night. You wake up and you're just drenched from sweat. It could also be unexplained weight loss, and it could be due to or it could also be shown through a cough, a persistent cough. Ebola is a little different. Ebola, when it manifests itself, Ebola is, like I said before, is a very violent disease. And when Ebola manifests itself, manifests itself through an extremely high temperature, once again, in a very rapid onset, very acute onset. And also it can present itself through extreme fatigue, extreme body aches, and bleeding through different orifices. So because the blood cells are rupturing inside the body, pretty much what's going on, and it's filling all these extra spaces in the body with all this blood that's being dumped in from cells, and through there being weakness in the veins and the capillary system, and it just starts dumping blood into all this extra space. You start getting bleeding from the eyes, from the nose. It could be the rectum, the ears. And if you've never seen an autopsy of an Ebola patient, especially one that had a very rapid onset and died very quickly of the disease, then you can actually see their insides have become liquefied to some sort, and it's almost like someone put off a bomb inside their body. Ebola is a very violent disease, and we're going to talk about Ebola in a lot more detail later on. Manifestation is also known as clinical presentation. So whenever you're in the hospital setting, or you're a paramedic or a nurse, or whatever avenue you're going to work in, whenever you have a patient that comes in and they are manifesting these signs and symptoms, we also call that as clinical presentation. And this includes both signs and symptoms. Remember, we talked about these in the beginning lecture. A sign is something that you as a clinician, you as the nurse, you as the paramedic, the physician, this is what you see. A sign is what you can physically see. And when you're noticing these signs and symptoms, or when you're noticing these signs, this is conducted through a physical examination, or what we also know as a patient assessment. Okay, these are used interchangeably. You can use physical examination, or a patient assessment. Patient assessment is probably one of the most important things that you will ever do as a healthcare provider. It doesn't matter what level you're at. It doesn't matter if you're a physician, a nurse. It just doesn't matter. One of the most important things you can do as a clinician is a patient assessment, and we have to be good at it. We have to know our certain way that we do it. Every clinician does a patient assessment their own way. And we do that for one reason, is because it's an investigation. You want to make sure you're asking every question every time to every patient. Okay? And so when we go off our own pattern of doing it, then that's when mistakes happen. That's when we skip over things. And the things we skip over can be those things that are so important that it could be the critical thing that tells us what the patient is suffering from, and it may delay treatment if we do not pick that up rapidly. Also, remember, symptoms refers to what the patient tells us. It's an experience the patient is having. These are not measurable. It's just something that's told to you. Nausea, weakness, fatigue. Once again, I can't visually observe nausea. I can observe vomiting, but not nausea. Okay, I can't observe weakness. Okay, I can't see that. I can go by what you're telling me that you're weak, but once again, that's not me observing that you're weak. Okay. Anytime we're asking patients about what they're experiencing, either the present condition or a past condition, this is known as a patient history. We normally lump these up together in the patient assessment, and we'll talk about that soon. When we talk about patient assessment, we're lumping in the history and physical. Okay, so the history of the disease, the patient's past medical history, and then of course the history of their current disease or illness. Now, there are sub-classifications of disease. Okay, well, so when we talk about structural and functional, now we can break that down even further into subcategories. The first subcategory is infectious diseases. These are diseases that are caused by a pathogen or microbial invasion. So anytime you have an invasion of something, whether it be a virus or bacterial, fungal, it doesn't matter. This is known as an infectious disease. Now, there are many different types. I mean, we're talking about thousands of different types of infectious diseases. You know, when we talk about bacteria, and viruses, especially viruses, we talk about influenza, Ebola, HIV, bacteria. We're talking about like E. coli. Now, remember, for those of you that have had medical micro, remember E. coli naturally occurs in our body. It's normally a bacterium found in the gut, and so we produce this normally. However, there's one strain of it that we don't. Escherichia coli, E. coli, 0157. And this is the one that causes an E. coli outbreak. So when our body is exposed to this, we get sick. When our body is exposed to HIV, we become sick. Okay. When our body is exposed to a fungal infection, we become sick. And this is an infectious disease. The second one is known as neoplasms, or new growth. The uncontrolled growth of abnormal cells. It may be benign or malignant. Okay, so this is when we talk about cancer. A neoplasm is just the beginning of a new growth of abnormal cells. And once again, this manifests itself as cancer. Now, the two categories of cancer are benign or malignant. Benign meaning it's not spreadable, it's not fully cancerous, it's not cancerous. So therefore, it's probably just a tumor or a fatty cyst. Malignant, this is something that is spreadable. This is full cancer. This is cancer that is spreading or has the opportunity to spread. Okay, and then we would formulate a treatment plan as clinicians to begin trying to treat this malignant neoplasm, this malignant cancer. That can look like radiation. That could look like chemotherapy. It could look like using both radiation and chemo, depending on how aggressive this new growth is. Immunological diseases. There are three categories: in hypersensitivity of the immune system, an underreaction of the immune system, and an autoimmune disease, basically the destruction of one's own tissue by antibodies produced by one's own immune system. So now this is a whole new area here, as far as this opens up a whole new different conversation, because AIDS, and we're going to talk about AIDS in very, very detailed explanations here later on when we get into when we have our full lecture on infectious diseases. But one of the reasons AIDS manifests itself is through lower immune system. People become ill with the same thing over and over again, and basically the doctor at that point will do blood work and they'll look at the T cells. And there's a drop in T cells, then this is indicative of HIV or AIDS. Now, HIV is the virus. Disease is the AIDS is what happens in the latter stages of HIV. Okay. Autoimmune diseases, we are seeing more of these rise up every day. As many of y'all know, my sister-in-law, who I've talked about, she suffers from some autoimmune diseases. One is alopecia, which causes all the hair to fall out. So she doesn't have any eyebrows. She doesn't, have any hair in her head. So she suffers from that. Also, she suffers from a certain form of lupus, and so this is just the body's. Basically, the body is waging battle against itself. Normal immunity, it fires back and starts battling it, thinking it's a foreign pathogen, thinking that it's an invader, and so it starts waging war against itself. Nutritional diseases. These diseases created by insufficient resources for the body. We talked about this a little bit when we talked about malnutrition and malnourishment. If you're not getting enough of certain things, protein, carbs, things like this, then we're not able to properly fuel our cells and fuel our body. And when this happens, this allows the opportunity for disease to come in. People who are vegetarians or vegan, typically they have to take different supplements, or they have to try and get these through some other mechanism. So, for example, protein. Protein traditionally is found through meat, whether it be red meat, chicken, turkey, fish, anything like this. You'll have pescatarians at times. Those are people who are vegetarian for the most part, but they will eat fish. Um, but when we talk about vegetarians and a lack of protein, typically the vegetables they eat, or the things they use to substitute for the meat, those have to be higher in protein to account for the protein that they're not getting through eating meat. Typically, they'll take more supplements and stuff like that to try and add that extra protein in. You also have a vitamin or a mineral deficiency. I have a vitamin deficiency, vitamin D. I have a vitamin D deficiency in my body, so I take a vitamin D supplement. I also take a multivitamin as well. So this can also lead to biochemical changes and reactions in the body, especially with the heart. Remember, the heart is known as the calcium-potassium pump. And so for your heart to operate properly, you have to have calcium in the body, and you have to have potassium. So anytime we're dealing with a severe lack in one of these, we can impact the function of the heart. Okay, so it's important that we know that when we go to doctors and we get blood work, that we know what areas we're deficient in. Because with some of these, it could be life or death that we're suffering a deficiency from. Obesity. Yes, obesity can be caused due to someone that just eats way too much, has a poor diet, lacks activity, or this can also be genetic based. There are many people who watch what they eat, who try to maintain a healthy, nutritious diet, but due to genetic factors, still keep gaining weight. Okay, and then the doctor will have to look at those and see about some other alternate plan to try and reduce the patient's weight. And this may stem through weight loss surgery or something of that nature to try and get a handle on it, because what you just don't want to do is keep ignoring this and the patient keep gaining weight until their body just can't take it anymore. Okay. And there are there's shows on TV about stuff like this. And typically many of them do not have happy endings. Metabolic diseases. When we talk about metabolic diseases, we're also talking about diabetes, stuff like this, an upset in the biochemical reactions that govern body processes or metabolism. Subclassified as nutritional because the upset is often connected to carbohydrate, fat, or protein metabolism. Okay, so this also links to what we were just talking about. And whenever we're deficient in an area, then this can also give rise to certain metabolic issues. Okay, and especially when we talk about carb, fat, or protein metabolism. Excuse me. We'll have people who are on no carb or very low carb diets, and that's fine. However, the problem is this: those are extremely hard to maintain. Okay, one of the biggest one out there is the keto diet, high fat, low carb diet. This is extremely hard to maintain over the course of a lifetime. Because if at any time you start adding carbs to the mix, then basically what you're doing is just eating a high fat diet, which is extremely unhealthy. Okay, you're not getting the benefits of the no carb or the extreme low carb. The other thing is this: your body has to have carbohydrates in order to function. Carbohydrates help your body repair. It helps fuel it. It powers the body. And so when we're cutting out carbs entirely, this can have a drastic impact and a drastic effect on your body. And this is why whatever good comes out of keto, ultimately people get off it and then they regain that weight back because they don't have a good sense of being able to handle those carbs in a healthy way. Okay, now for the most part, everyone loves French fries. No one's saying never to eat French fries or potatoes. Everything in moderation. Okay. Genetic diseases. Talking about genetic diseases, we're talking about there being a genetic abnormality in the chromosome. All right. So we are all familiar with the double helix and how we all have 23 chromosomes. Okay. So when we talk about genetic diseases, we're talking about there being a dysfunction and abnormality in one of those chromosomes somewhere. Okay, we see it with diabetes. We see it with people who are hemophiliacs, cleft lip, sickle cell. So when we talk about genetic diseases, this is what we're talking about. It could come from one or both parents. There's an interesting court case years ago here in Texas. Excuse me. A husband and wife were getting a divorce. They had 3 boys, all triplets. They were getting a divorce, and the father was taking them to their doctor appointment for one day, and the doctor goes, "Man, it's really nice to see you caring for these boys. You're treating them as if they're your own." And he's like, "They are my sons." He's like, "No, they're not." And he's like, "Wait, what do you mean?" He's like, "Sir, all these boys suffer the same genetic disease, and this genetic disease comes from the father, and you don't have this genetic disease. So I'm sorry, it's impossible for you to be their father." And he's like, whoa, wait a minute, what? Here's a man who believed that these were his sons. He's been taking care of them since day one. And now he's paying child support on these kids that are supposed to be his kids. So he goes to his ex-wife and says, "You had an affair and you got pregnant. You didn't tell me. These were my kids." And she confessed and said, yeah, she had had a long-term affair with someone, and these were not his biological children. Well, he went to court to try and stop paying child support. Well, the court ruled and said, "I'm sorry, we can't. Blood tests cannot be used to disprove paternity. Blood tests can only be used to prove paternity." Basically, the blood test can only be used for someone to be told, "Yep, you're the father," but it can't be used legally to show and say that, "No, you're not the father." So that's a pretty interesting court case that happened a few years back here in Texas. Congenital diseases. Diseases that normally are at birth. They happen in the fetus, and typically the patients that have congenital diseases are born with these. It could be functional or structural. Underlying causes could be the mother's use of drugs, alcohols during the pregnancy, exposure to certain chemicals. Back in the 70s, there was a weight loss medication that was prescribed to people. And one of the side effects that people did not realize, including the physicians, was that it caused genetic congenital defects. So you had thousands upon thousands of babies born with all these congenital defects caused by this medication that these women were being prescribed. And there was a massive lawsuit about it, and a lot of money was dished out to a lot of people because of misinformation. One of the ones you'll typically see is actually a congenital defect of the heart upon birth of the child. Many babies have heart defects that most can be fixed surgically. Unfortunately, there are some that just cannot be fixed surgically. Trauma. Trauma impacts and disrupts the body. We're going to talk a lot about trauma in this course because it impacts so many different things, and we're exposed to it on a daily basis. That's why we have trauma ERs, because unfortunately, trauma happens every day. This can be the result of bruises, abrasions, penetrations, impalements, cuts, fractures, burns, anything like this. If you are driving in a car and you get in a car accident and you are ejected from the vehicle, this is trauma. This has a negative impact on your body. Okay, that's why it's important to wear the seatbelts. Okay, so we're going to talk a lot about this as we go through the course. Physical agents, diseases that result from physical agents such as temperature extremes, electrical shock, radiation, and poisons. Okay, if you get shocked, there is a reaction that occurs in your body. People who are struck by lightning sometimes have long-term effects from this. Also, this can cause your heart to stop. Why? Well, your heart is an electrical organ. It runs off electrical impulses. That's why when your heart stops and it's in a certain rhythm, VFib or VTAC, we can shock your rhythm back into operating properly. Sometimes they convert, sometimes they don't. Whenever you see on TV shows and you hear they're in a systole, shock, that is incorrect. A systole is known as a flat line. That's basically when the patient is on the monitor and there's a flat line going across the screen. That is not a shockable rhythm. You are just pumping on the patient's chest, performing CPR at that point. There is no shocking for that. They will not convert from a shock from that. That means there is no electrical activity or impulse in the heart whatsoever. Okay. Inflammatory disease. Diseases that are usually secondary to a primary disease, such as infection or autoimmune disease. Okay, so your patient already has an infection going on, and then they develop something else due to that. So when we're talking about inflammatory disease, we're not necessarily talking about a joint or something becoming inflamed. We're talking about inflammation to a body area, to somewhere that is trying to fight off disease. Inflammation causes harm to the body. That's one of the things we're seeing with COVID, is it causes inflammation. So if you have patients that are already dealing with a disease that causes inflammation, well, now we're adding COVID into it, which is causing more inflammation. And this is many times why patients die or succumb to COVID, is because of all this inflammation going on in the body. Typically because it's caused by a secondary infection. During physicals, you will perform different tests. And we need to know these different tests and know the medical terminology for them. So if I'm using my stethoscope and I'm listening to someone's lungs or someone's heart, or if I put it up to the neck and I'm actually listening to the blood go through the carotid artery, this is called auscultation. I'm auscultating the lungs. I'm auscultating a blood pressure, which means I'm using the stethoscope and I'm listening to the blood pressure. Okay. In this course, how we'll use auscultation more is in regard to blood pressure. So everyone in here's had their blood pressure taken for the most part. They put the BP cuff on, and at least on the old school days, they'll put the stethoscope right in the break of the arm, known as the AC, the antecubital, and they'll listen to your blood pressure. They'll pump it up. They'll wait to start hearing the thump. So basically, if I'm listening to the blood pressure, as I start decreasing the pressure on the cuff, it'll be silence, and then I'll hear thump, 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 thump. And now what I'm doing, I'm waiting for that thumping to go away. Thump, thump, thump. So when I start, the first time I hear the first thump, and the time I don't hear the thumping anymore, this is your blood pressure. This is what I'm listening for. This is what I'm auscultating, okay? Now, for those of us that are in EMS and we're EMTs and paramedics, we may be in a place where we can't actually hear the blood pressure. There may be a lot of noise going on, or maybe the blood pressure is so faint, I can't auscultate it. So at that point, what I'm going to do is I'm going to palpate it, which means I'm going to put my fingers on the radial pulse, and I'm going to pump up the blood pressure cuff. When I release it, I'm not going to feel that pulse, but then as I start to release it, and the first time I feel that pulse in that in the radial artery, that is known as palpating a blood pressure. We'll talk a lot more about this later on. Or if I'm feeling around on organs, if I'm pressing on someone's belly trying to palpate internal organs, that's what I'm doing. I'm palpating, I'm touching, I'm feeling, okay? Percussion. Sometimes you see the doctor, they'll put their hand on a certain part of the body and they'll kind of tap their hand or tap around that area. Well, they're causing vibration and they're listening for certain sounds, either a hollowness or a filled area. And this is known as percussion, okay? This is tapping or hitting an area, just like percussion. I'm a drummer, I'm a percussionist. I hit drums, I hit timbales, I hit congas and bongos. I'm percussing them, okay? Examples of signs are temperature, blood pressure, respiratory rate, abnormal heart sounds, mass, enlarged organs, edema. I can take someone's temperature. I can visually see their temperature. I can feel someone's blood pressure. I can watch and feel someone's respiratory rate. I can hear abnormal heart sounds. If a patient has a heart murmur, I can hear it. If a patient has a mass in their abdomen, I can feel it. If a patient has an enlarged organ, typically, depending on where it's at, I could feel it. Okay, edema. If someone has swelling of the legs or in the arms, I can feel the edema. I can also visually see the edema. I can see the swelling. Patients that suffer from congestive heart failure or diabetes oftentimes suffer from peripheral edema. So you'll be able to see that and feel it. I'm going to stop right there for today. We'll pick the rest of this up next time. Now what I'm going to do is I'm going to open it up to any questions we have.